Today I'm going to be talking about restless leg syndrome and spasticity and multiple sclerosis, but also drop foot. We're talking about these symptoms of MS because they really impact our life and our quality of life. They occur like if we have multiple sclerosis, or if we're living with multiple sclerosis, we have 7 times more likelihood of having restless leg. And the vast majority of people that suffer with MS, they also have the spasticity and eventually drop foot. So there are solutions, and that's why we're going to talk about it. We're first going to speak about what these symptoms are and then how they impact us. But then we're also going to talk about the solutions because that is really the focus. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I talk about these topics because I was diagnosed with MS 30 years ago, and by the grace of God and a lot of work on my part, I learned very early on how to reverse the disease by treating infections. And we're going to talk about the infections that are causing these symptoms of MS. But I've also had the amazing privilege to coach over 600, or I should say 700 students in the Live Disease Free Academy. And that's a lot of students. Most of the students I work with, they suffer with or from multiple sclerosis, but they also have other diseases. And so I'm going to do a series talking about the different types of symptoms in multiple sclerosis. And I will talk about optic neuritis next week, but I wanted to talk about the restless leg syndrome, spasticity, and drop foot in MS today, just because I have some really important information that I wanted to share with you that was quite new and relevant. So let's start with restless leg syndrome. If we have multiple sclerosis, we have at least a 7 times higher possibility that we will suffer with restless leg syndrome. Maybe you guys can share with me if any of you have experienced restless leg syndrome and what it feels like. I haven't. That wasn't one of the symptoms that I had with multiple sclerosis. But from what I've heard is that it's this awful feeling that you just have to move your legs. You're trying to get rid of this feeling, and it could be burning or just an awkward feeling, twitching. It can be involuntary movements. It can be pain, it can be cramps, etc. So it can be all of those different symptoms. Burning sensation, creepy crawlies. And as we become more disabled and as we have more of the lesions in the MRIs, we are at a higher risk of having the restless leg syndrome. And it happens more at night. And I want you to think about at night when we're resting, the parasites are a lot more active at that time. So we have to pay attention to that. That's another little hint that I just want to leave you with, is that we know that MS is caused by a parasitic infestation, and we know parasites are more active at night. So it would make more sense if we were dealing with more of the restless leg syndrome or symptoms in the evening when we're sleeping. And important to know too that the restless leg syndrome is also associated with leg cramps and pains. So there's this overlap between the spasticity and the restless leg syndrome. What I truly believe is that yes, there are times where maybe we would get a Charlie horse, maybe we're deficient in a certain nutrient. But I think for the vast majority of us, that just from personal experience and working with hundreds of people, is that in the early stages of dealing with parasites, we might start to get some little warning signs. So we might get these weird sensations in our legs occasionally, and we're healthy and we just ignore them and we don't know what they are. Healthy people that think they're healthy, they might get some symptoms of the restless leg syndrome even before they have MS. They could get Charlie horses. But what we find with chronic disease is that as the population of these parasites increase over time, then these symptoms become stronger and lasting longer. And so we may not just get the odd Charlie horse at night. Maybe we think, oh, we're deficient in calcium or magnesium, but we're getting them more frequently. And that's where these spasms come in. But with multiple sclerosis, it ends up that we start off with these Charlie horses, especially in our calves, but then they end up becoming permanent Charlie horses where we have like our muscles become rigid. It's just incredibly painful. I've never experienced that either. I also caught the MS before I had those issues, thank God. But my heart goes out to people that suffer with them. I can't even imagine. I have had a Charlie horse before, and so I know how awful they are. So to have something permanent like that, where your muscle just goes rigid, and then eventually drop foot, where our foot is extended down, and then we can trip over that also. So with restless leg syndrome, it's important to know that it's not just multiple sclerosis, people that suffer with that disease, that they're the only ones that deal with this, but also it's associated with Parkinson's, ADHD, Alzheimer's, celiac, all the inflammatory bowel disease, Crohn's disease, rheumatoid arthritis, sleep apnea, diabetes, and depression. And all of these conditions are also caused by different infections for sure. So about 25% of people that were diagnosed with multiple sclerosis will have restless leg syndrome in their lifetime with the MS diagnosis. And it's really terribly uncomfortable. So the restless leg syndrome, it's not those severe spasms like the spasticity, but it is a problem because it is one of the symptoms or condition, I guess you call it a condition, that causes people to have a hard time falling asleep. And so that really helps us to become more sleep deprived. And then, of course, our immune system is not as strong, it's more compromised. And then we have it's not dealing with the infections as well. So it's a spiral. So as we have this restless leg syndrome and we are not able to fall asleep as well, we're not sleeping as well because it wakes us up, or we have a hard time just falling asleep because our legs feel so awful, then we have less sleep, a weaker immune system, and then the infections become more active, and then we can have more of the spasms, and then more of the spasticity, and then more of the drop foot as the disease progresses in time. And very important to share that it's the restless leg syndrome. Like, we might just think about like the creepy crawly sensation that we can't fall asleep, but it can also be involved with movements, involuntary movements of our muscles. So where we might have our legs jerking or twitching, jerking while we're sleeping. It can happen every 15 to 40 seconds throughout the night sometimes. So it's awful. And the exciting thing is that all these things can be dealt with. We can deal with them in two ways. One is that we could use certain drugs that will manage the symptoms. And other ways we can do it is to treat the infections that are causing these symptoms and then just get on with our life. And that's the path the wellness champions choose. So this restless leg syndrome will really impact our quality of life. We become more sleep deprived, more sleepy during the day, not able to perform as well in our life, but also the advancement of the disease itself is going to occur because our immune system is tired. And it's associated. So what are some of the things, like what are clues in the scientific literature of what restless leg syndrome is associated with? It's associated with low blood iron, or I should say low iron in the brain, so low ferritin in the brain. And we do know that when we have parasites, that we definitely become anemic. That's a very common symptom of parasitic infestations, is low iron. So again, it's not that the low iron necessarily causes the restless leg syndrome, but they're seeing a link that it's very common that people have low iron, especially the stored iron in the brain. And that is something that we want to treat for optimal health. Another thing that I wasn't aware of is an increase in SIBO, which is small intestinal bacterial overgrowth. Again, this is linking to infections. So those of us that have chronic disease, very often we have a lot of bacteria growing in the small intestines that should not be there. And I'm not going to talk about that. I believe I've talked about that in a previous video. Go ahead and check down in YouTube, Live Disease Free. But when we treat the SIBO, then the restless leg syndrome seems to be helped a lot. maybe not cured all the time, but it's definitely, I've seen different practitioners talking about how it's really helped the restless leg syndrome. So very important to deal with the SIBO. And like one study that I looked at, it was a small study. They had 7 people in the study. All of them had the restless leg syndrome, but they also had SIBO. So it was like 100%. And of course, that's a small study, but that is still a fairly strong correlation. In the general public, only about 15% of people have SIBO. And as I mentioned, the practitioners that have been treating the SIBO have noticed that it's really helped the restless leg syndrome. So that's something that if you're working with a practitioner, you definitely want to check. And then the next one I wanted to share is worms. Increased connection between the presence of worms and restless leg syndrome. So again, there's not a lot of research in this area yet, but we're digging and finding it. So one study, which is fairly recent, 2017 case study, there was a participant who had restless leg syndrome and also an infestation of hookworm. And as they treated the hookworm, the restless leg syndrome settled down. So it's very interesting, and it's really sad that in the developed countries, we believe we don't have parasites. So I wonder how often it is the case that it's the whipworm, or maybe it's filarial worms, etc. We're going to talk more about the spasticity now. So I just want to say hi, Judy. Hi, Joanne. Hi, Fawn. Awesome. You guys are there. And I just want to say that it sounds like the audio is good. I had some technical issues last week, but sounds like it's all good now. So spasm. So we do know that the restless leg syndrome can cause spasms, muscle spasms, and also pain. But when we're dealing with multiple sclerosis, we can have a lot of spasms to the point where we end up with spasticity, which I mentioned before is like a permanent Charlie horse to our calves or other muscles also. Very, very painful. And it is really an awful, it affects our mobility tremendously. It's incredibly painful. At the beginning, it can come and go, and it's hard for people to know what can make it worse and what can't. What I can just speak from personal experience is that we have found that the parasites that are causing the MS symptoms, they thrive on carbohydrates. So as we decrease the carbs tremendously, like going down to 35 to 40, but a lot of people find that even below 30, somewhere between 20 to 30 total grams of carbs, they notice huge improvements in their spasms. So why would that be? Because whatever microbe is causing the spasms, it feeds off of glucose, sugars in the blood, and so and even in the intestines, because there is this big highway of nerves between the intestines and the central nervous system. So sometimes the parasites will be in the central nervous system causing grief to our nerves, but sometimes it's in our intestines, in our digestive tract. So when we are going really low carb, we're putting those different types of microbes on a fast, whether they're worms, whether they're bacteria. We're going to talk about bacteria. We're going to talk about protists, which are single cell parasites, or worms. And then as they are not getting as much food, they're going to be less active. We start to see inflammation goes down, and we start to have really significant improvements in things like bladder function. We're going to talk about all these things as we move through the series, but today we're talking about the spasms and the restless leg syndrome and the drop foot. So just by changing our diet, by going low carb, we're seeing that a lot of students are noticing significant improvement or decrease in the spasticity, which is so incredibly awesome. We still have to treat those critters, but it's really exciting because that's something that we all can change. We have control over that. So with respect to spasticity, I'd like to talk about some of the different possible causes. Number one, thanks to the work of Dr. Alan MacDonald, finding small roundworms in the spinal fluid of every MS patient, 10 out of 10 patients, and many of them, and they were swimming around, they were in clusters, they were mating, there was eggs, there were immature forms. Every single MS spinal fluid tested, lots of them. Veterinarians have known that for 100 years, when these worms get in the central nervous system of domestic animals, that would be sheep, horses, cattle, goats, etc., those animals have all the symptoms of MS. They have the extreme fatigue, they have cognitive issues, they have balance issues, spasticity, drop foot, blindness. It's shocking, the similarities. So that was really what turned us on to this whole angle, and wondering, well, I wonder if those animals have the worms in their central nervous system, they have all the MS symptoms, and people that have MS, we're finding them in the central nervous system. I wonder if the same medications would be helpful. And we found, yes, they have been incredibly helpful. And there are studies, like if you're a science buff, you can go online and you can look up cerebrospinal nematodiasis and look at animal studies. And you'll see, like, one that I just pulled up just before was looking at a roundworm, a little filarial worm that it lives in deer, so white-tailed deer in the United States and in Canada. When it's in the deer, it is called a silent infection. So it's not really bothering the deer. But when the deer deposits its waste on the grass, and then our domestic animals are eating that, they're picking up those parasite eggs and they're eating them. And then as these, for example, this study looked at sheep, and as this sheep is picking up these worms, they end up with these symptoms of spastic gait or spasticity, etc. So we can learn a lot by looking at the animal studies and to say, like, how are these worms, how are they impacting animals? And could those similar worms be causing the symptoms that we're dealing with? And the answer is yes. Why? Because we see, as we're treating what they use in the animals, when we're using that in humans, it's changing people's lives. And I'm going to share a couple of really exciting successes with you so you can see that. What I found really interesting is also tetanus. So tetanus is an infection caused by a bacteria called Clostridium tetani. And when this bacteria invades the body, it produces a poison that causes painful muscle contractions. So there are various ways that these microbes can cause us to have these horrible contractions. It can be a poison that they produce. And then I found another doctor today. I was listening to a podcast, Dr. J. Lombard, and this is true for ALS also, which was really exciting because some of my students have ALS, finding that these bacteria, and he was talking about Clostridium C. diff or C. difficile. And so that is a bacteria that if we have an infection in our intestines, then it can cause death. It's brutal. It's helped by fecal transplants. That's, I think, basically the most helpful. We end up with this position of having this bacteria if we use a lot of antibiotics. But what he's finding is that he believes that bacteria are playing a really big part in all neurological diseases. And so he's using heat therapy, so hypertherapy, where you're really heating the body up to quite a high temperature. But what's so exciting is that he's finding, or he believes, that this C. diff is really a big part of what's causing. And what I wanted to share about that is that sometimes the bacteria will denature proteins so that they can't do their job in our body. So that's another way that these microbes can cause problems. So either they're impacting something that's functional in our body, or it could just simply be that they're producing a toxin that is in some way causing us to have these painful muscle contractions. And then another thing I wanted to share with you is that there's this protozoa or protist. It's a single-celled parasite that infects horses, and that causes, again, spasticity or spastic gait in horses, and it can, I'm sure, in humans if we get it. So The problem is there are so many different microbes that are out in the world. Last I listened to Dr. Klinghardt, he said there's over 200,000 worms, right? That could become a problem for humans. Never mind protists and different bacteria and other small microbes, fungi. But this, what I've shared with you, is just like the tip of the iceberg to help you to see that we need to go back to common sense. We need to go back to like not dealing with a mystery. It's like our muscles are spasming. Oh, it's a mystery. It's our immune system, going haywire. Things in life are very simple. It's like your body needs certain nutrients to operate properly. And if you're giving them all those nutrients, it's genetically programmed. It knows how to operate. Or maybe it's struggling with some type of infection or infections. And when we're dealing with chronic disease, we know that we're really out of balance. So just as Dr. J was talking, he was saying that, and Dr. Hyman, they were talking together, that it's not usually just one microbe that's out of balance. And that's what we're finding with our students too. It's kind of, there's multiple, and we call it, we're in a state of dysbiosis. So at some point we're on a lot of antibiotics, sometimes before the age of 10, threw us out of balance. Too many of the wrong microbes are growing, disease causing. And could it be different for different people with MS? Yes, it may not always be filarial worms in the central nervous system that are causing all of the problem. Maybe they're commonly there, but maybe that some of us, there's another huge area that I'm studying, is that there is like a malaria type, babesia type, protist type microbe that is definitely involved in MS often. And of course, Borrelia is, and these filarial worms are. And so, and I'm sure that the bacteria also, some of these pathogenic or disease causing bacteria. So it's not to overwhelm you, because it's not really that hard to treat them, because there are certain treatments that will cover a variety or different groups of parasites. So it's not that hard to do. We don't have to wait for 20 years until all the research is in. We can definitely start prepping to treat and then start treating and getting our life back. And I just wanted to share with you what happens when we do that. So we have the Live Disease Free Academy, which is a 3-month online course where I support students in getting ready to treat and treating, where I help them to get ready and then get access to practitioners and treatments so that they can start to treat. So Darmo shared, we had our call yesterday, and these are just a couple of updates from students. Darmo shared, I'm still improving. I can't wait until I'm 100% cured. That's why I'm so diligent. I'm on my 7th round of parasite medication. So what they'll do is they'll prepare first by supporting the body, by weakening the infections. And then they'll do one cycle is about 14 days of treating parasites, then 10 days of treating fungus, and then taking a break. That's one cycle. So he's on his 7th parasite treatment. And we can talk in a minute about why we have to do several treatments. Why can't we just do one treatment and be done? I wish, but no, that's not the case. And my greatest improvement so far, a huge reduction in spasticity. That's what we're talking about today. Sometimes it's actually gone. And also, most days I experience an awesome improvement in pain. Now I would say that both pain and spasticity are not a problem anymore. Also, the sensation in my right leg continues to improve. Before I started the academy, I could barely feel it. So he had a lot of numbness. The second student I wanted to share, we had more, but I'm just keeping it short here. Harry shared, I have finished my first round of medications for both parasites and fungal overgrowth. I have so much more energy and strength. Walking and balance are back to normal. So we're all different. Some of us recover more quickly than others. And this is, there's a lot to it as I'm coaching students. 3 weeks ago, I wasn't able to do even one push-up. Now I am doing 10 3 times a day. I went for a 40-minute walk, which was a vast improvement from just 2 to 3 minutes before starting the program. So I'm going to go to your questions just for a moment here. So that gives you an idea of what happens when you are treating infections that are causing the spasticity and the restless leg syndrome and the drop foot. And we have had students that have recovered from drop foot also. I can never promise full recovery, but what I can say is that with our experience of working with over 700 students, that you will have a lot more recovery than you ever thought possible when you treat the infections effectively, when you treat these parasites effectively. And what's so exciting is that, before we thought everything was permanent damage to the myelin sheath on the nerves, but we're seeing that there is so much that's still in the inflammation stage. And that is super exciting. So it's a very, very exciting time for people that suffer with any kind of neurological disease. So what I found really exciting was that little piece also for ALS, and just doing the hyperthermia treatments where you increase the temperature in your body, and that helps to kill especially spores of certain different types of infections. All right, so I'm going to go to a few questions here. I'm happy that the audio is working. Hi, Abu. Hi, Alexander. Hi, Dawn. Hi, Ronnie. So it comes along with the drop foot. Yeah. So normally what'll happen with MS is that we might get these muscle spasms occasionally. We might even have restless leg syndrome first, just odd feelings and sensations and pain or tingling or tremors or jerks, etc. And then we do get spasms, and that's part of restless leg. And then it becomes more frequent, more painful, stronger, and eventually what's happening is that we're ending up with like permanent locking of our muscles, like a permanent spasm, a permanent Charlie horse. And my heart goes out to people that have that. It's just brutal. But the exciting thing is we've seen so many people reverse that, which is so awesome. But the thing is that, taking a medication to try to help manage the pain is not the answer. You have to get down to the root cause. That's really what helps you to recover, is to get to the root cause, which is infection. Hi, Valerie. So how many of you have had restless leg with multiple sclerosis? Again, they say that it's about 25% of MS patients have restless leg syndrome. You've been anemic since you were in your 20s, Fawn. So that is a really big sign that you've had parasites since you were in your 20s. So our food is definitely more deficient in iron. But it's interesting how, like in a family of kids, you'll find like one child will be anemic and the rest are not, and they're all eating similar foods. But when you start to really look at the person who's anemic, very often they have gut issues. So malabsorption, because they're dealing with dysbiosis, they're not absorbing the iron as well. But another really big factor is that these parasites are freeloaders and they are making us deficient in the iron. And that's really, really common. And then as we do become more anemic, for us women, when we have our menses and we have a heavier flow, where we end up losing more iron also. So it may not be that the anemia or the low iron or low ferritin in our brain is really what's causing the restless leg syndrome. I think that they are things that are linked together. They're associated together quite often, and it's because of the parasites, I'm sure. But can't hurt to definitely increase our iron. Very important for health. Say hi, Abu. Most likely due to stomach antacids. Yeah, so definitely we don't want to use antacids. If we're dealing with acid reflux or acid problems, esophageal problems, it's usually because our stomach acid is too low, and that's showing up in research all over. So when you have low stomach acid, then microbes start to grow like H. pylori, and they produce acids, and then we end up feeling like we have acid reflux, etc. But as we eat differently, so we're not feeding that bacteria, and then we take supplements like betaine, HCl. This is stuff you can talk to your practitioner about, but taking some extra betaine, HCl, and then also maybe some digestive enzymes, we're finding that students are able to, number one, not have that acid reflux anymore. Very, very important. Hi, Joanne. Keeps cutting out. I'm sorry to hear that. I'm so glad you love learning about this. Yes, this is the answer. This is where it is that we have to correct our microbiome for sure. Is glucose in the fruit? Yes, it is. So fruit is really healthy, but unfortunately, fruit is full of sugar, and these microbes don't care if the sugar comes from fruit or if it comes from like a cookie or pop. So very important to decrease fruit sugar also. Besides the low carb diet, Judy, that's just the first step. So in the academy, what we do is, number one, stop feeding the infection. Number two, support the body, making sure we're sleeping at least 8 hours a night. If we don't sleep, we won't heal. Having daily bowel movements, looking at our blood work, supporting our physiology, cleaning up our environment. We just go through a checklist. And then by that time, people are already feeling a lot better. And so with that, then they are getting ready to treat. And so this is where they look at their symptoms, their health history, the health history of their parents. Sometimes they're energy tested on the most common parasite drugs to see which ones test the best for them. And then they are given prescriptions, and then they go through the cycles. So if we just jump right to the treatment, we are very disappointed, because with the doses we're using, and we also layer the treatments too. So we're using antiparasite drugs, we're using oxidizing agent and herbs, and all of the rest of the system as far as not feeding the infections and supporting the body, etc. It's all very, very important. The nematodes are found in the brain central nervous system. Absolutely, Kevin. And Borrelia, so that's very important to mention. So very often the bigger worms, they may not be causing the worst symptoms we're dealing with. They definitely cause symptoms. And when we pass them, we feel a lot better. But they carry their own microbes. So they can be infecting us with Borrelia, with other microbes, with these type of Babesia, which is kind of similar to malaria. And that seems to be really present in MS also. So it's not just the big worms that we're dealing with. We're dealing with things that we can't see that could possibly be the biggest part of what our acute symptoms are, especially when we're going through an attack. So just because your lumbar fluid is clear, Joanne, that doesn't mean that you don't have microbes growing in it. Unfortunately, we don't really look, the healthcare professionals are not really looking at your spinal fluid for infections. They're only looking for some immune markers, unfortunately. So it's good that it's clear, but you would only be able to see that under a microscope, and somebody who's skilled at this, that would be able to pick that up. And yes, biofilms are an issue, not just with yeast, Abu, but they're an issue with all, like Lyme disease, etc. So a lot of these microbes will produce this slimy coat, a tent that they hide under. And there are little holes and channels, so our fluid will go through and feed them and give them, liquid and nutrients and take out the waste. So it's like a little city, a little village underneath. And that protects these disease-causing microbes from our immune system, but also from medications that we would be using to treat them. So we do deal with the biofilms also in recovery. Very important. Awesome. Hi, Eric. How do you join the academy? So all you would do is, if this is the first time you've met me and you just would like a little more information to kind of make sure that you think that I'm legit and what I'm talking about makes sense, I've got a ton of videos on YouTube. You can watch, pick and choose the topics you want. We've got playlists on the infections, on the diet, on different things. When you're at the place where you're like, this makes perfect sense, and I've been following you, I've been listening to your stuff, and I'm just ready. I'm ready to treat these infections. If you need support, I can do that through the Live Disease Free Academy. And what you would do is just watch. You'll see that when I'm done, there will be a link posted either with the video and in the description and below, maybe in the comments, where you can listen to my masterclass training. So it's important to listen to that, because that talks about these infections in detail. You hear a lot of case studies. You hear the steps we take in a general sense, and then you can book a time to chat with me. So you're going to fill out a form from that. And then that comes to us. And then if we feel that you're ready, then we will, that just means ready, that you're at the place where you're like, no, I want to treat these infections and I need your help. Then we will send you an email with number 1, the coachathon. Please listen to that first, because that goes into great detail about the academy. And then you'll have good questions for me, and then you and I will chat, and you can join before, but I'm going to be talking with you to get to know you, your health history. We're starting a journey together, and that is the exciting part. So the wellness champions that I'm working with are the leaders, trailblazers, and forward thinkers. They are people that are, I'm not aware of anywhere else in the world at this point, unfortunately, where, I mean, there are some clinics where you can go to and they will try to identify infections and treat them, but you will be spending thousands and thousands of dollars. I've called them. You can call them anywhere between 40 to 80,000, which it doesn't have to cost that much. So the wellness champions are doing a lot of the heavy lifting themselves, which is not heavy lifting at all. They're just playing an active role in their health. They're really learning how to take charge of their health and to do most of it themselves. It's the most cost-effective way. And then once you recover, you are going to want to treat these parasites at least once a year, probably twice a year, especially if you've had chronic disease before. And that way you keep them at bay, and then you're also building back the good microbes all the time and just learning how to live in this world, this crazy world that we're dealing with right now, to protect yourself and your family. So that's the Live Disease Free Academy, and there it is, the masterclass training that you would listen to, that'll start, and people can join within, like, listening to that within a couple of days. You can become a wellness champion if you're ready. How do you determine the antifungal meds? We find at this point that energy testing is the best. We are actively looking. So I'm also had the amazing, just huge privilege that we've 4 organizations have come together. They love the work we're doing, and we've all joined forces for MCITY, the Multiple Sclerosis Infectious Disease Initiative. And we are just getting all our ducks in a row to start to do clinical trials. And we want to find tests, and we want to identify the most common parasites that are causing the MS symptoms. And this is going to overlap to ALS, PLS, Parkinson's, Alzheimer's, etc. And then from there, what kind of protocols? What are the best treatments? So we're right now in the stage, we've got together and we're getting feedback from the students, and we're finding partners of different doctors. So if you know of doctors that are really interested in infectious causes for diseases, make sure to connect us with them, because that's what we're doing, is building that, and then foundations to support. It's quite a process. So I'm really grateful to team up with these people that have so much experience in all of that area. So at this time, because we don't have good stool tests, we found the most helpful is that when students will take 1 dose of the most common parasite drugs, they'll take them to either a chiropractor that does applied kinesiology, or a naturopath that does some type of energy testing, muscle testing, or they might use a machine. And that really helps them. Those practitioners can determine if a certain treatment is balancing out their patient, or strengthening their energy field, or making no difference at all. And we've used that, and that's been really helpful. So after working with a couple hundred students going through that process, we're really starting to see patterns of what seems to be the most helpful for people that suffer with MS. And again, the parasite drugs are not a magic cure by themselves at this time. It does take, because doses and, biofilms, as one of the people were mentioning on this call, there's a lot of things to consider. So that's why people really appreciate getting help in the academy, because we consider all of these things, and individual environments too. Like what is your environment like? Are you sleeping enough? Do you have a big cell tower outside of your home? Do you have mold in your home? All of these things will hinder your recovery. So it's my job to be an investigator, to help you to make it, you do everything you can in your power to make the treatments work the most effectively. And that's where we see the magic, is when we do this all together. So Judy, currently you're on prednisone taper. What should you do next? So the prednisone is simply like, there's a war going on in your body. And with that war, it's caused by your immune system is fighting something. And I would assume that it's fighting infections if you have a chronic disease. And like, all the diseases are stemming from chronic infections. So what prednisone and cortisone does is it hampers, or it suppresses your soldiers. All right. And so what you've done is you've settled down the war by suppressing your soldiers. And now you're coming off of that again. And so it's good that you're coming off of it you have to go off of it slowly and carefully, but you have to remember that every time, like if we lived on them, it would just, I believe it brings us to disability quicker because it is such a powerful, powerful immune suppressor. But now that you're coming off of it, the big thing is just to start with the eating plan, just to stop feeding those infections so much. Play around with it, use a chronometer, just calculate the total grams of carbs, decrease them to where you get to 35 to 40, or if you want to be a real keener, see if you can get lower. How do you do that? I share in the videos, but you're really just eating a lot more different types of leafy greens. And yes, you can eat some of the other low carb vegetables, and you're having moderate animal protein with each meal, and you're also having enough healthy fat to maintain your weight. You'll notice a huge improvement with that. And just watch my videos. If you want support, reach out to me. But as when you go to the treatment part, you're going to have to work with someone. Very important. And unfortunately, most of our integrated practitioners don't have a lot of experience in treating parasites yet. We're hoping that through the work of M-City that we're able to really get this to go mainstream, but it's going to take time, unfortunately. We're all coming together, volunteering our time, and there's a big system in place that doesn't want to budge, so it's going to take time. Hi from Florida. I wish I was in Florida. The weather, but also the freedoms that you guys have there. It's pretty tough in Canada right now, really tough. So Judy, you're 55 years old. You've had MS since 32. There is hope for you. I can't promise full recovery, but I can tell you that we have students that have had MS for 30 years. They have not walked for 5, 10 years or more. And they, after maybe 12 treatment cycles, they are starting to take steps. And I never promised them they could, but they're so determined, and they're treating and treating, and they're taking back their mobility. One of them, her hand, she couldn't use it for years. It was just locked up. And now she's using it, and she's even able to shave her armpits. So it's really cool. So this is the answer, and see how much recovery your body can give you, but it will come only from treating these infections for sure. So drop foot can't come 15 years diagnosed, so you're dealing with MS. You're dealing with it for 3 years now. If you've had the drop foot for 3 years, again, I can't promise, Sherelle, that you're going to have full recovery, but we've had lots of students that have had drop foot resolved. So I would just see what kind of recovery you can have. Just treating the infections as effectively, allowing your body to heal. There is so much that is still in the inflammation stage and not in the permanent scarring stage, which we didn't know. Is there a way to know what myelin damage versus inflammation? No, there isn't. And that's Kaylin. We don't know. We don't have a good way of measuring that. But as I mentioned, working with students, some of them that have not even had a diagnosis yet, and they are like, I have so many symptoms of MS and I don't want to go there. I'm just going to deal with these infections, get on with my life. Of course, for them, it might be 3 months and they're symptom free, but they're still treating longer. And then there are other people that have had it for 15 to 30 years, and they are determined to get better. And they are starting to use crutches and starting to use like walkers to walk again, and they have to build back their muscle. And that's even 5 or 10 years is a long time not to be walking. So just treat the cause, support your body. You will have a ton of improvements. You will feel so much better. And the nice thing is that working with your doctor, you'll be able to come off of the disease modifying drugs because the disease stops. So the process will stop and you'll have a lot of recovery. And that's the exciting part. How do you determine which are the antifungal drugs that you would use through energy testing? So Alexander, you are participating in a clinical trial for multiple sclerosis. So lumbar punctures, when you have them done in a study like that, they're only looking at certain things, unfortunately. they're looking for antibodies. They're usually looking for, that's what they're looking for, is antibodies. They're not looking for infections, unfortunately, which is sad. So you can have, we know that the central nervous system is not a sterile environment. You can go on to livediseasefree.com, our website, under research. You'll see a whole bunch of studies, and they're finding fungus growing in the central nervous system, in brain cells, in the nucleus of brain cells. They're finding Borrelia there, which is the spirochete that causes Lyme disease. They're finding all kinds of critters, the worms. Dr. Alan McDonald also found immature tapeworms and larvae sacs of tapeworms. So just because it looks clear to you or it looks clear to them, and they've looked only at antibodies, that means that they're missing the boat. They're not looking for parasites, unfortunately, and I don't know why. Okay, that's there's more questions, but I'm going to let you guys go. Yes, Ty, you're wondering if I was diagnosed with multiple sclerosis. Yes, I was 30 years ago. And I was so fortunate that when I was first diagnosed, like I had severe optic neuritis, and that's what we're going to talk about next week. It was like this for 6 weeks, like total blackout. And then I was on prednisone, and it came back just enough that I could walk in a dark room. So right now I could not drive with this eye. And then I had terrible tingling and insomnia and headaches, and I was flatlined on the couch. I had 2 little kids. My mom stepped in to help me, and I got on the track of infection very, very early on. And I didn't know all that I know now, but I started with learning about Candida. Then we learned about Lyme disease. And yes, we talked about, or the practitioners talked about parasites, but they really didn't have the information that we have today about parasites and multiple sclerosis. And watch my videos. I've done videos on there's a whole playlist on infections with multiple sclerosis. Last week and the week before, I talked about leaky blood-brain barrier. I talked about leaky gut, which are all characteristic symptoms, conditions in multiple sclerosis. So it's all there. The research is all there. You just have to decide if you're going to take a different path or not. You have to decide, am I going to continue to suppress my immune system with all the cost and adverse effects, and I will still become disabled? Or am I going to decide to start to treat, like to start learning about it, getting ready to treat, and start to treat them? And maybe you want to be part of our clinical trial. We're aiming for about June to have things sort of ready to start. But I mean, I personally wouldn't wait that long. If I knew what was causing this horrible disease, I would be on the bandwagon. And number one, even just following the eating plan so that you start to slow these critters down, so that you start to have the symptom improvement. And then make sure to watch my masterclass training and reach out when you're ready. So optic neuritis was your first symptom too, Judy? Yeah, I had that too. Actually, my very first symptom was when I was pregnant, and I would bend my neck down in my with my doctor getting my checkup during pregnancy, and I would get that little tingle running down my neck. That was the very first, and he never said anything. So, he was probably hoping that that wasn't MS. But then after 6 months after my second child, like he was 6 months old, and that's when I had the severe optic neuritis. We're going to talk about that next week. And you guys are going to be really surprised what's causing that also. So Victoria said, I just had a hunch. So you don't know if there's recommended time. You left your feet in the salts for several hours. You don't know. Let's see here. I'm not sure what that is. I really have no idea. I know that infection does not like salt, but all I know is that the base camp of the problem is in the gut. That's the highest concentration of these disease-causing microbes, the parasites. They have moved into different parts of the body. They're in our blood. Oh, and that's another thing too, is one of our students in Europe, a med student, looking at her, testing her blood and another MS patient's blood. So she had MS. She said it was very easy to find these filarial worms in the blood, very easy. So you can imagine that if you have little worms in your blood, do you think that might cause issues with your restless legs or with circulation, etc.? Absolutely. and I can't remember if I shared the World Health Organization. Yeah, maybe I missed that. The World Health Organization was speaking about lymphatic filariasis, so the little filarial worms in the lymphatic system, also part of spasticity. So there's all of these between human and between animal studies that are showing worms and bad bacteria and single cell protists are definitely causing all of these spasms, drop foot, and the restless leg syndrome. What do I think about Epstein-Barr? I'll just do 2 more questions here. Epstein-Barr, the vast majority of the population tests positive for Epstein-Barr virus. So then we should have a lot more people that have MS if that's what's causing MS. What I believe is that when you are really out of balance, you have severe dysbiosis, you have a lot of disease, different types of disease-causing microbes and not enough health-promoting microbes, then the smaller microbes become a problem. The bacteria become a problem. The viruses can be active too then. Are they really the front runners and the biggest culprit? No. So we never focus on viruses. We start treating the biggest worms first, fungus second, and then we treat bacteria, etc. after that. And so, with the parasites, obviously protists, etc. So parasites and the fungus parasites, and then the smaller bacteria. So that's our cycle. But the Epstein-Barr virus, I just haven't seen enough evidence that I believe that it is a cause of MS. Because number one, viruses are not alive. They don't eat food. So if you go low carb, there will be no difference in your symptoms because they don't eat food. They're not living. And we see huge improvements when we go low carb. So that to me sounds like it's more like a bacterial or a parasite or a fungal type microbes that are the problem. And as you treat those and you restore balance, then your immune system will deal with the viruses. You can try Epsom salts, baths, etc., but it's really not going to make a huge difference, Joanne, for sure. All right, so with that, I'm going to let you guys go. And next week, we'll be talking about optic neuritis and multiple sclerosis. And if you are at the place where you're like, Pam, this makes so much sense, watch my masterclass training, reach out, fill out the form, I should say. That's how you reach out. You fill out the form at the end of it. If you feel you're ready, that's only for people that want support and feel they're ready. And then you'll be getting an email from us. Watch the coach-a-thon because then you'll learn all about the Academy in great detail, the cost, the steps, what's all involved, how to find practitioners, how to get access to treatments, all of that. And then you and I can chat if you have any questions. Otherwise, join and you can start on your journey back to health. So with that, I'm going to let you guys go. Make sure to subscribe to our YouTube channel if you like to learn about all these infections, live disease-free. And please share this information with others. We've got to get discussions. We've got to get groups talking about infections because that is truly our answer. So with that, take care and bye-bye for now.